Hello, my name is Dr. Dewan S. Raja. Today I will discuss about bicuspid aortic valve. What is the definition? Bicuspid aortic valve is a congenital cardiac malformation in which aortic valve has two cusps leaflet instead of normal three cusps. It is the most common congenital heart defect. So this is normal aortic valve. It has three cusps. This is a semilunar valve. It guards the ascending aorta. So in bicuspid aortic valve, we have one cusp here, another cusp here. So two cusps instead of three cusps. Bicuspid aortic valve epidemiology, prevalence 1 to 2% of general population, more common in males 3:1, around that ratio, often familial, autosomal dominant pattern with variable penetrance associated with Notch1 gene mutations, often diagnosed incidentally during echocardiography, workup for murmurs. What is the embryology? Result from fusion of two of the three endocardial cushion during aortic valve formation. Leaflet pattern, right left cusp fusion most common, right non-coronary fusion, left non-coronary fusion. This is least common. Pathophysiology, bicuspid aortic valve leads to altered hemodynamic stress, promoting early valvular calcification. Aortic stenosis, most common complication. Aortic regurgitation, aortopathy, dilation of the ascending aorta or aortic root. The intrinsic abnormality in the aortic media with cystic medial degeneration increases the risk of aortic aneurysm and aortic dissection. Clinical feature, most patients are asymptomatic until early adulthood. Will get murmur due to aortic stenosis, harsh crescendo, decrescendo, systolic murmur. At right upper sternal border, radius to carotids. Aortic regurgitation, early diastolic, decrescendo murmur at left sternal border. So here left sternal border, diastolic murmur. Here right upper left upper right upper sternal border, and this is a systolic murmur. Symptoms when complications arise: exertional dyspnea, chest pain, syncope, classic triad of aortic stenosis, palpitation, heart failure symptoms. So you get dyspnea, chest pain, syncope, palpitation, heart failure symptoms. Bicuspid aortic valve associated condition, coarctation of the aorta, Turner syndrome, aortic root dilation, aneurysm, ventricular septal defect, that is less common. So mostly associated condition like coarctation of the aorta, narrowing of the aorta, Turner syndrome, that is 45X0, aortic root dilation, aneurysm, and maybe ventricular septal defect. There is a possibility also, but less common. Diagnosis, echocardiography, gold standard. Finding, leaflet with fish mouth opening. because we have two cusps. So we'll see fish mouth opening on echocardiography. Rees may be present, assessment of stenosis, regurgitation, and aortic root dimension done through echocardiography. CT, MRI useful in evaluating aortic root and ascending aorta diameter, aneurysm, preoperative assessment. Complication, valvular problem, aortic stenosis most common, occur earlier than tricuspid valves. Aortic regurgitation, aortopathy, aortic root dilation, ascending aortic aneurysm, risk of aortic dissection, especially when diameter more than 5.5 centimeter or greater than 5.0 centimeter with risk factors. Infective endocarditis, increased risk due to abnormal leaflet architecture. So we have problem in the valve, we have problem in the aorta itself. As complication, management, surveillance, regular surveillance, regular echocardiography at least once in a year. It may be more frequent depending on the physician and the condition of the patient. Blood pressure control, we may use beta blocker. Okay, maybe angiotensin converting enzyme inhibitor or angiotensin receptor blocker. Blood pressure control, surgical indication, aortic valve repair or replacement for severe aortic stenosis. Symptomatic or left ventricular effective force is less than 50%. Severe aortic regurgitation, symptomatic, that is left ventricular ejection force is less than 50%. Severe aortic regurgitation, symptomatic or left ventricular dilation. Aortic repair indicates aortic root or ascending aorta more than 5.5, greater than 5.0 centimeter with family history of dissection, rapid progression, or coexisting indication for valve surgery. And that's all about bicuspid aortic valve. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.